We're live. Bonjour. This is again the Bruno and Judith show. We just met in Paris for the ESMO TAT conference, and we are heading for Copenhagen, Denmark, for the European Lung Cancer Conference. And today we're going to talk about our conference planning solution, CONF, and how it applies in particular to preparing for ELCC. Judith, the microphone is yours.
Thank you, Bruno. So certainly we'll be heading to ELCC next week. And in here you can see the conferences that are upcoming. So we have attended ESMO TAT, VMT, indeed it's taking place this weekend here in Madrid. So, and we will be also there in AACR and ESMO PC. But today we will be focusing on ELCC. So let me dive in there. We can see that we have already 173 abstracts and 15 posts. Of course, we are talking about pre-conference. So based on previous years, we have seen this is going to be 300 times, well, 30 times more for sure. So let's see what's the buzz currently and how it evolves.
Just before you do that, Judith, let me pose and just say a general comment for people who are listening for our podcast for the first time. So what we do at LARVOL is that we provide cancer data across many different solutions, notably for congresses. In Congress, one of our specialty, in addition to analyzing in real time all of the material available on the conference website, is to add on top of it a layer of commentaries, not from us, not from Judith and Bruno, but from the 6,000 oncologists that we have indexed on Twitter. So our AI would read at all of their tweets, and each time they mention one of the clinical trials presented at ELCC, it will extract that tweet, analyze it, positive, negative, neutral, even why it's negative, for example, and then think about it as another layer of color and commentary on top of these presentations, these sessions, these abstracts. Back to you.
Indeed. So as you were commenting, I'm gonna open, we build some analytics based on the disclosures that being presented, the top trials ranked by the number of posts that will be associated to those disclosures. So in here, we can see those top trials. Certainly, we are in pre-conference mode. And not only that, but the ELCC abstracts were just released today. So we can expect that the new comments will be coming out soon with more thoughts or sentiment or behind the data that will be disclosed in the upcoming conference. So currently, everyone is being quite neutral. Yes.
I cannot help but make another comment. Yes, so the abstract, the full abstract, are expected or already have been posted today, or are they expected today?
Indeed, today. Today they were released.
Have they already been? They've been released already.
You got me. I would have to check it out. Yes.
Okay, right. But if it hasn't happened, it's going to happen now, essentially.
Anytime soon. Yes. Indeed.
Now, the one thing I wanted to say is that. This is not something on the CONF platform, but something else that LARVOL does, is that we use our AI to make a prediction about what the data will be. We'll post it on social media. We already did, as a matter of fact. You might actually show it. Actually, why don't we take a little detour for ELCC? We'll come back to the planner. Go back to the feed, the first tab. Of our platform. Now, on the feed are material that we already posted on social media. And on the feed, you would see a recent post that involved, you'll find it in a second, that involved our predictions. Perhaps it's not there, right? Perhaps it's, that's the one. So it's a little tough to read, but after this call or during this call, go to either social media or go to LARVOL CLIN, and you will find here our predictions for the data. Not the fact that the data will be presented, but we predicted what the data will be using our AI. Now, we did it before for other conferences, and we're refining our AI and our predictions, but we've never done it with that scale. So it's going to be a bit of a moment of truth for us to see how our AI did. And our AI, in a couple of words, it's a jury of AI, if you will. So we are relying not just on ChatGPT, but on ChatGPT, Gemini, Grok, and Claude together, with a bit of a jury approach in making these predictions, and a lot of prompt engineering, obviously.
Indeed, certainly this what we are showing in here in the screen would be for the different studies that we've released. We'll be having the LLM based prediction based on the different models. So ChatGPT, Gemini, Claude, and Grok, as you were mentioning, and then the final consensus right to the very right end. So you would be seeing the hazard ratio, whether it would reach statistical significance, and the median values as well.
Show us again the KM curve that we have
indeed
rendered.
That's the new approach that Tim has been working on. And in this case, this would be using machine learning, right? So we would be predicting how would the KM curves be.
Actually, in this case, this is LLM. We are
LLM
working in
well,
parallel with a more traditional machine learning approach, using the data set we have in our data repository, and we're going to combine our machine learning with the four main models to see how well it does. And we'll do that for AACR, less clinical data, of course, and also for ESMO BC, the next conference. But you can already see the way the AI predicted this curve. And one of them in particular, right, the left bottom one, the AI predicts essentially that there will be no differentiation between the two curves. And we'll have to see if it's right, because it's a little odd. I'm wondering whether that's not an artifact for that one. The two curves are exactly overlapping. It might be an artifact. It might be a glitch in the matrix for that one. Yes.
Certainly.
Right? Latify. Do you know if there is an expectation for that trial?
Certainly, we can take a look at it.
You know, I'm curious about that. Let's go to Latify on CLIN, on our CLIN database, and see what people are saying about Latify for overall survival. I suspect that it's a little glitch. It's too perfect. And by the way, to our listeners, our approach is built in public. So when we see a problem, we don't hide it or skip over it. We actually drill at it because we're building it together with you. And if you're listening, leave us a comment, ask us a question. We're live. Or if you're interested also in trying our platform, let us know, and we'll set up either a pilot or a full demo. So let's look at the post.
There's a late-breaking abstract expected for ELCC, right? So starting there, as per the post, we can see right now that there are 9 posts. Most of them, they are negative, but there's one.
Let's look at the negative. Let's look at the negative. Why is it? Because it will be, okay.
There's lack of efficacy in one hand. Let's see.
Okay, so, I think I know what happened. There's been a press release that said that trial did not work. So we know the result is negative. And so what the LLM did is that, well, if it's negative, let's assume a hazard ratio of 1.
It's going to overlap.
So he got a little lazy here, and he's just got the two curves to overlap with another. I think we sorted it out. Okay. Yes. Mystery solved.
That's the reason why, certainly. So let's see if it's predicted correctly then, though.
Well, there'll be no glory here because we know the trial is negative.
It's negative. So that would be for the Latify. Let me go back to the feeds and the forecast. So now that with the abstracts released, it would be interesting to be able to compare at least those hazard ratio data points, if they have been correctly predicted, or which is the R-squared between those predicted and real data points. And if we go back to the here, let's go back to the original page where we were seeing the top trials. And we can see here also there's some late-breaking abstract being expected for North Star. Indeed. Let's see if now with the abstracts we'll be having more data. Let's see what they are commenting already. So we are talking about this stage 3/4 non-small cell EGFR mutated trial. And right now there are expectations. So bit neutral comment. As per more general analytics that we might take a look at, we could be seeing which are the top diagnostics or the top genes per abstract. So certainly EGFR, PD-L1, and ALK are the top 3 genes covered by those abstracts. The top drugs would be osimertinib, pembro, durva, and aulomertinib. We can even compare them with previous years. So durva has lost a bit this year, but also it's still there on the top. Pembro as well. The top MOAs would still be PD-1 inhibitors, PD-L1, followed by EGFR. And I would say ELCC top conditions, it's going to be all around lung cancer, right? So let's see what's the bus going to be evolving during the following days while these abstracts get released and the data, the posters get presented, like in upcoming week.
One final point before we wrap up that podcast is that when we work with a customer to cover a conference, there are several components to our solutions. So one is this online platform, Conf. But the second one is a companion solution called Conf Insights. And what we do with Conf Insight is that we have customized reports that we send to our customers before the conference. We analyze the title, let's say. During the conference, at the end of every day, maybe actually if you have one handy, we didn't prepare, but if you have one handy, Conf Insight from another Congress, that give audience an idea. At the end of every day, we have a recap about that day. And then at the end of the conference, we have a recap of the conference itself that includes all the data and an analysis of how the data was received by key opinion leaders. This
about
is
ASCO,
yeah.
GI, but
yeah, sure. So that's an example. So we do now. We're not doing that for all of the cancer conference that we cover. We cover about 30 to 40 cancer conferences, but we provide that enhanced reporting for the top 15 conference. And for the top 15, we are typically there in person, by the way. So that allows us to also capture data that sometimes it's going to be available online on a delayed basis, especially specific slides of interest. So if you can see here, so this is the kind of report we generate at the end of the conference, hours, not days, after the closing of the conference. And that gives you a full view of what mattered at that conference, a summary of all of the data. And then for each of the key various heat maps and analytics to have an overall view of the data by company, by key opinion leaders, by asset. And then for each key disclosures, each key presentation of trial, we have a summary, essentially, of all the most important commentaries. So we don't comment ourselves on the results. We rely on the top voices in the field, but we collate and organize their views. And we also finalize what we call the impact rating of that trial. Think about it as a bit of a credit score for how that trial, based on its results, is going to impact or not standard of care. So that's it. Any final words on your side, Judith? And then we can wrap up for today.
Indeed, we'll be at ELCC, so don't hesitate to reach out. Would love to connect and share with you like all we do. Yes.
Thank you.
Thank you very much, Bruno. See you there.
Bye-bye.